To those of you who are joining us for the first time, we are so excited to have you with us. I am Jessica Strong, and I am the co-director of applied research here at Blue Star Families. I am joined by my wonderful colleague from Syracuse University's Institute for Military and Veteran Families, Rosie Maury, who serves as their Director of Applied Research and Analytics.
Yes, hello everyone and welcome to this data deep dive on the report, Understanding the Diverse Experiences of Military and Veteran Families of Color. This really is a culmination over more than a year's worth of research, focus groups, analysis of existing data, a comprehensive survey, many conversations really to understand the unique experiences of military and veteran families of color. IVMF and Blue Star Families have partnered on the annual Military Families Lifestyle Survey since 2014, and we were thrilled to have the opportunity to collaborate on this project as well. Back to you, Jess.
Thank you, Rosie. Before we go too much further, I want to thank everyone in the audience who attended yesterday's event. It was so meaningful to have all of you join us to celebrate the report, hear the stories behind the data. If you weren't able to attend, though, you can find a recording of the event on our website, and our chat moderator will drop a link in the chat. Now, this data deep dive will continue that work by exploring the military family of color experience. As always, there is not enough time to go into every detail that is in the report, and we encourage you to go explore those findings on your own and, during and after the event. Please reach out if you have any questions. You can read the full report on our Blue Star Families website, and the chat moderator is also going to share a link in the chat. Back at you, Rosie.
So the purpose of these deep dives are really to provide additional data and context around topics. We have our moderators who are going to pose a handful of questions to our research, but again, as Jess mentioned, there's so much more in the report, so please visit the website. We have three goals. We want to present some additional data relevant to yesterday and earlier sessions as well. We want to also have the opportunity to answer questions about the data or the findings, but most importantly, we want to be able to provide an opportunity for discussion.
Now, because this is a live session, the research team will do our very best to answer your questions, but some questions are going to require more digging, and we may not be able to provide an immediate answer. If we aren't able to provide a response during the session, we are definitely taking notes. We may be able to provide a response in a follow-up email. I want to note here that we might not be able to answer all of the questions because our data may not allow it. We may not have asked that question. We may not have a sample that will allow us to answer those questions that you have. Often when we drill down to very specific groups, sample sizes are too small to responsibly report. Your questions, however, even if we are not able to answer them here, they do help us provide some direction for future survey iterations, and we want to continue doing this good work. So inevitably, answers to research questions provoke more research questions, but we're excited at this study that this study is just the first in this ongoing series on military families of color.
So before we begin, we do have some general rules. Please type your questions in the chat. We have several team members, including Jess and myself, who are able to respond to them if the conversation and time permits. Also, please be respectful and considerate when framing your question. We're going to remove vulgar, inappropriate, or inconsiderate participants. And of course, we know that behind every story or every statistic is a story, often a difficult one. And that discussion may evoke memories of personal experiences, and we want to meet you where you are today. So if you are ever feeling overwhelmed, anxious, depressed, or have other big emotions during this event or afterwards, support is available for all military affiliated individuals at Military OneSource. You can reach them at www.militaryonesource.mil or call them at 800-342-9647. The reality is that while these data is important, the stories are often more important when it comes to helping others understand the importance of this work. So if you're willing to share, please share your story with Blue Star Families to help change the narrative on the issue. Please submit your information to the link our teams is sharing in the chat, and our wonderful storytelling teams will connect with you. And finally, as you probably noticed at the beginning with the Zoom pop-up, we're providing another friendly reminder that this session is being recorded. And with that, thank you for joining us. At this time, I'd like to pass it over to Mr. Val Nicholas to introduce our first panel.
Hi, I'm Val Nicholas. My background is I spent most of my career at NBC in one form or another, NBC Entertainment in Los Angeles, MSNBC, and then I was vice president of NBC News. Now I am Senior Vice President of a company called Summit Media Corporation. I am a veteran, United States Army Armor, but I come from a military family. My father was Air Force, and his father before him served as well. So I have a deep understanding of what we're talking about here because I've lived it. The other thing is this is so important that I dug deep into the back of my closet and found a jacket to wear. In this time of Zoom, it was damn near impossible to find it. And fortunately, these guys don't know me that well. Otherwise, when they did the statement about eliminating vulgar people, I would have been gone by now. But I'm still here. Anyway, we're going to be talking about the research, the findings, the stuff that came out of the actual 18 months of work, and how that how we can use that to advance this conversation and actually make some change. So I'd like to welcome back two people that you just saw. I'd like to welcome back Jessica and Rosalinda. And then I would also like to introduce Kelly Clore, the Amazon Food Insecurity Deploy Fellow at Blue Star Families. As we go through this, we'll do these questions first, and then there'll be a little bit of time at the end for you to kick in some questions. So hold your questions until these guys go through this stuff. Let's see. I don't have the teleprompter like you guys, so I'm reading off a sheet here. The panel questions. This one is for Jess. This is a stat. Half of the active duty respondents characterize their families' overall financial situation growing up as challenging. I'm one of them. Occasionally had difficulty making ends meet. 25% said it's tough to make ends meet. 19% said they were unable to make ends meet. So Jess, service members of color, are they doing better or worse as a result of joining the military?
Well, spoken like a true researcher, it depends. It depends on better or worse compared to whom. So in some ways, they're doing both better and worse. Service members of color in our survey generally reported that they were doing better or much better than their friends or family of a similar racial or ethnic background who are not in the military. So in comparison to civilian peers of similar backgrounds, they are doing better, most. But even if military service offers a financial advantage in comparison to civilian peers, service members of color still report less household income than their white military peers. So when you compare to civilians, they're doing better. When you compare to white military peers, they're not doing better. So the answer is a little bit of both.
Yeah, that was probably the situation with my father. You know, when I was growing up, that's exactly you hit it on the nail right there. All right, let's move on to another one. This is another stat. Nearly half, 43 to 49% of active duty spouse respondents reported a variety of employment outcomes to be somewhat or much worse than their non-white friends and family who are not connected with the military. And so this is for Rosie. What are the major differences in employment outcomes between military spouses of color and white non-Hispanic military spouses?
Yeah, so a big contributing component, I think, to economic stability and decision-making, especially in the military, is military spouse employment. And certainly we've been looking at unemployment earnings for a number of years. I mean, we talked about the partnership since 2014. And we've been in this for a decade, and what has been constant for military spouses is that unemployment has remained high and earnings has remained low. And certainly that can have a great financial impact, in particular for military spouses of color. Research has shown that in a given year, active duty military spouses are 2 to 4 times more likely to be unemployed compared to their non-military counterparts. And certainly for military spouses of color, that's 3 times more likely. We talked about this earlier. We used multiple data or multiple methods to analyze certainly the economic outcomes for military spouses. And one is using federal data. And according to the 2019 American Community Survey, military spouses earn about roughly 37% less than the total population, 37%. And female military spouses in general earn less than male. And certainly these gaps get greater, especially when we talk about when we include Black and Hispanic Latina female military spouses. So for female Black military spouses, they earn about 54% less. That's on average 24,000 compared to 42,000. And for Hispanic Latina military spouses, they earn about 66% less than the total. That's 21,000 compared to 42,000.
Yeah, and my mother, who was Japanese, had another issue on top of it. She barely spoke the language. So getting a job with us moving around every year and a half or 2 years, and she's not very good at English, was very difficult. She was smart enough to figure out that she could do sewing. So she was a seamstress, and wherever we landed, she could take in people's drapes and do that stuff. But yeah, it was very, very difficult. I don't think she ever got a real job outside of the stuff that she generated herself. Okay, another statistic. Active duty family respondents of color to the 2020 Military Family Lifestyle Survey reported twice the level of food insecurity as their white non-Hispanic counterparts. This is for Kelly. At what rates does food insecurity impact military families of color, and what factors contribute to this? Those differ for different military families.
Great to see you again, Val, and thank you for that question. Food security means that your food is nutritious, affordable, physically accessible, and culturally appropriate. So any inconsistencies to that could mean that you're food insecure. So respondents of color reported twice the level of food insecurity as their white non-Hispanic counterparts in the MFLS. And those results of the survey showed that 14% of respondents of color reported low or very low food security compared to 7% of white non-Hispanic respondents. Like Jess and Rosie have already mentioned, some of those factors that play into food insecurity is spouse unemployment, spouse underemployment, childcare expenses and availability, out-of-pocket costs. But another factor to remember is that military members of color are overrepresented in junior enlisted ranks and underrepresented in officer ranks. Add in the systemic issues in our society, military members of color still deal with systemic racism that's responsible for creating racial wealth gaps. Respondents also share that they face barriers to getting resources such as SNAP and WIC and school lunch programs, mainly because there's a lack of awareness about these programs, but also because they either feel like they don't qualify for them or they may not actually qualify for them, such as with SNAP benefits, whenever the basic allowance for housing, BAH, is counted as income. So resource sharing organizations, like all of us, we need to do the work to make sure that we're connecting to military families of color who are experiencing these unmet needs. Food insecurity also carries shame and stigma. So we need to actively listen to our respondents. We need to create safe, judgment-free space for them to share their stories. And we need to take destigmatizing this issue very seriously so that we're not blaming food insecurity on financial mismanagement. This issue affects current mission readiness, it affects retention, and it affects our future force. We know that whenever kids are growing up in food insecure households, they have a higher risk for health problems. And military kids grow up and serve in the military. So as Jenny said earlier in the first session, recruit the service member, retain the family. This issue is just far too important to ignore.
Yeah, my father's African-American, and even though we probably could have used some of those additional support systems, there was no way in hell he was going to do that, and what would have been nice is if somebody would have given me, my mom, my sister, some information on how to talk to my father about it without making him angry. That might have been helpful for us to get into some of those kinds of systems. So I totally understand what you're saying. So we have a little bit of time left, so we want to get some audience questions in here if we can. And Jenny, can you?
I do. Yes. Thank you all for joining us. The chat is blowing up, so we're going to try and keep
Awesome.
answering questions there too. But for our panel, is it that just service members of color are more likely to be enlisted, while white service members are more likely to be officers when we're talking about financial issues?
I'll take that one.
Jump in.
Sorry, Val.
No, jump in.
Thank you, Jenny. Yes, that's part of the answer. Certainly, we have a whole finding on service member career progression and how there is a little bit of a discrepancy between the officer corps and the enlisted corps. And so I won't go into it too far here, but that is a valid point. But it's important to look at things like promotion rates and specialties and special pays. All of those also contribute to household income. But a key piece that is part of this conversation about household income in military families of color is spouse employment. As Rosie mentioned, spouses of color are more unemployed. They also report less income than their white peers. And that is also going to contribute to the gap that we see in household income by race and ethnicity. So it's not just, it's not linked to just one variable. It's linked to a whole bunch of different things.
Next question.
Great. I do want to provide a quick definition, so I'm going to take a little bit of pause and do that from the chat. How are we defining families of color? When we say that, we do mean a respondent who identified with at least one racial or ethnic identity other than white. And we did use a combination race ethnicity question that also included Middle Eastern and Northern African. When we talk about the family unit, we are talking about somebody who identified as either a service member or a spouse, and we deduplicate that. So if you're both, you only count once when we're talking about the family. So thank you for raising that in the chat. Now, back to the questions. We do have some questions about the effect of the pandemic on finances overall. So just to the panel, are families of color facing more difficulties now than before the pandemic, or about the same? And I will also ask you to weigh in on how they're doing compared to their civilian peers, if you know.
Rosie, you're nodding.
Well, I guess because I was relying a lot on the federal data. Unfortunately, I don't have that data to answer those questions, but we do know from this study and certainly from MFLS is they are impacted. And certainly the pandemic has impacted everybody. In particular in finances. Some people had to, leave their jobs to take care of their kids. And that has a financial impact. Some people had to take less of it's not a promotion, but certainly we're able to keep a particular remote position and again, offer less pay because of that. I imagine there's a lot more that others may want to contribute, but absolutely the pandemic has had a financial impact on military families of color.
Jesse, Kelly, either one?
Yeah, let me jump in there and piggyback off what Rosie was saying. So one of the things that we found in this survey is, again, when we're comparing military families of color to civilian peers of similar racial and ethnic backgrounds, nearly half said that they, even since COVID-19, their family's financial stability is somewhat or much better than their peers, than their civilian peers. So to me, that indicates that military service might have had somewhat of an insulating effect on the impacts of the COVID-19 pandemic. Now, it hasn't removed all the effects. It hasn't alleviated all of them, but it may have insulated military families in some way, including military families of color.
That is really interesting. Well, you can keep sending your questions in. They'll keep getting answered. We're running out of time on this particular moderation, and we're going to go to another one. But one thing that I'd like to thank Jesse, Rosie, and Kelly for this information, because it was terrific and it was really easy to understand. If you can make it so that I can understand it, then anybody can understand it. Also, I'd just like to say, those of us who served and those of us who are in a military family, which serves as well, the one thing that I'm gratified that all of you are here for, and what I would challenge you to do is, when we signed up, we raised our hand and we basically said we would protect the country, but we also said, made a promise that we would never leave anybody behind. And as far as I know, we never put our hands back down. So this group, all of you out there, it's our job to reach out to those families that need help and give them that help. That's our job. That's our mission. So this thing that we're doing with Blue Star Families is probably pivotal in getting that mission done. So thank you, everybody. And now I'm going to pass it on to our next moderator, Rear Admiral Sinclair Harris, he's wonderful. You're going to love him. He's going to moderate a conversation on military children. So stay tuned for that. It's going to be great. Right after these words. No, wait, we don't have words. Never mind.
I believe the children are our future. Teach them well and let them lead the way. Teach them all you know the song, 1977. But it's to the point of what Blue Star Families did in this research on military children. Yesterday, if you were listening at all, you heard a number of the military officers talk about their children and the issues their children ran into as military children, even when they were the children of generals and the Air Force and Army. It's our children that are important. Hello, everyone. Again, Sinclair Harris. I'm affiliated, proud to be affiliated with Blue Star Families as one of the committee members under the outstanding leadership of Lieutenant General Gwen Bingham, U.S. Army retired. And thank you, Kathy, for allowing me to be a part here to represent the Navy. So we're going to talk about military children, and we've got two incredible researchers, Rachel Linsner, who's on our doctoral research program at IVMF in Syracuse. My niece actually went there, so go Orange. And Cindy Rivera, the Senior Manager for Equity and Social Impact here at Blue Star Families. Ladies, thank you so much for the research you've done along with the rest of the fellows. And let's get to the questions. And again, please just put them into the chat as you and the audience have questions as well. Almost a third of the respondents to the survey with child care needs report diversity of faculty, administration, and diversity of student population as a top 5 attribute. Another third of the parents of school-age children report diversity of faculty, administrators as a top 5 attribute. So the question for you, Rachel, I'll start with you. With a third of the respondents citing diversity as an important attribute when considering child care in schools for their children, can you tell us, are military children of color attending diverse schools and childcare and getting diverse childcare?
So much. Yes. So as you mentioned, we first asked respondents to think about what are the really important attributes when you're considering childcare providers or programs, when you're considering schools for your children. And for both those active duty family respondents of color who need childcare and those who have children enrolled in K through 12, diversity of the student population and diversity of faculty and administrators were top considerations for them, top most important attributes. So then we followed up and we asked a little bit more about their perceptions of the childcare provider or program or school that they were a part of. And we asked them a few questions. We asked, does the staff at your child's school or daycare reflect the diversity of the families within that program? We asked, are there toys, reading materials that reflect diversity and inclusion? And are there opportunities for children to interact with, for your children to interact with children of other races, other cultures, other backgrounds? And overwhelmingly, respondents of color said, yes, they agreed that those circumstances were in place at their children's daycares, at their children's schools. The percentages were a little bit lower when we asked families whose children were older, so children who are enrolled in K through 12, which is a reflection of what we see in the civilian literature, that a lot of civilian families of color are saying, you know, the teachers and staff at my children's school aren't as diverse as our family or as the families in the community. Thank you.
Excellent response. Thank you so much, Rachel. The next statistic that we pulled out from a great amount of research that was done, according to unpublished data from 2020 Military Family Lifestyle Survey, for families who needed childcare, more 33% of active duty respondents of color required weekly full-time child care so they could work and attend school 35 hours or more a week, compared to 23% white. And I tell you, being the only child of a single working mom who was in the Army, believe me, that was important. It was important. So Cindy, over to you. Are military families of color able to access child care they need?
Well, what we know, and I'm sorry I don't have a song, even though I've been trying to think of a song for the past few minutes here, but what we do know is that there isn't a disparity between kind of, and this is going back to our 2018 MFLS data that was analyzed. So we know that there isn't a disparity in access to data, or to childcare between families of color and their white counterparts. However, there is an access issue across the board. Almost a quarter of our respondents are saying they're not able to find, or a quarter are saying that yes, they were able to find childcare. The rest are having issues. So Rachel and I are both moms, and I think we can speak to that. We know how it feels, and we know how that impacts the work that we can do. And what's really interesting is some data, both from our survey and some outside surveys, show that military families of color are actually accessing on installation childcare at higher rates than their white counterparts. So that's, to me, that seems like maybe that's a thread to start pooling, of asking like, well, why is that? Why are we seeing that there's a higher rate of utilization of these on installation childcare centers versus people sending them to babysitters or using things like in-home care? So that's what we know. But childcare is an issue, and it's really hitting all military families equally. So
thank you, Cindy. And I tell you, probably cost has a lot to do with it as well, because childcare costs just keep on escalating. A final question, then we're going to go to the audience. So the data from the 2020 MLSF showed little variation by race, ethnicity on the number of school-related measures. When asked to respond to the item, my oldest child seems to feel a strong sense of belonging to their school, 64% of white, non-Hispanic active duty military family respondents strongly agreed or agreed. And 64% of Asian respondents, 61% of Black respondents, and 60% of Latino. So for both Cindy, first Rachel, then Cindy, can you discuss why there's little variation by race, ethnicity to school-related items, and can this be seen as a positive indicator for military children of color?
Thank you. Yeah, I think that we should see this as a positive indicator for military children of color. And again, you know, it's parents reporting out on their children's experience. So it sounds like, you know, if parents have a positive sort of outlook, that's also a good thing. One piece that I saw a great comment in the chat here earlier on about how many schools have no clue what our military kids go through as military children. And I think that is an extremely valid point. And one thing that, you know, Cindy and I talked quite a bit about as we looked through this this data and these responses, both, you know, quantitative and qualitative, is that there's an intersectionality here that we're not always able to kind of tease apart. So alongside those questions about belonging, we also asked about parents' perception of their children's school, supporting them through a military life event, whether that's, you know, like reintegration or deployment or separation or something like that. And those percentages were lower. So it's sort of this intersection of being a child of color and also being a military kid. And when do those two sort of identities impact different interactions, impact their experiences at school? And so that's something I think a lot about, and I know Cindy does as well, in terms of future research, is how can we kind of better understand the relationship between those identities and experiences.
Cindy, anything to add?
The only thing to add is that some of the, like when we reported on that sense of belonging, what we know about belonging is that in a school setting, civilian research tells us that a sense of belonging really impacts educational outcomes. So there's a tie there. That's why it's important that there is that belonging, because we know that that can have long-term educational impact. So the fact that our parents are reporting this, we hope is a positive story, that the lack of disparity means that something good is happening here for our military kids of color.
Well, ladies, thank you very much. We're running very tight on time. I think we have enough room for one question. So Jenny, do you have one question you want to pull out from the chat?
I do. Can you ladies please discuss the impact of COVID-19 on military children? And if you get a chance to also to discuss how the extent to which this past couple of years have played in for our military kids and the qualitative responses.
Rachel, I mean, COVID's been rough.
I can kick that off. Yeah. So we asked about, in our MFLS research, we asked the parents to sort of share if they felt that their children were doing kind of like better or worse on a few different aspects of their life since, the pandemic began. And when we compared active duty family respondents of color to white respondents, actually the white respondents were saying, my children's education, circumstances are worse. Their mental health is worse. And so one of the, again, like sparking additional research questions in our brains, one of the pieces there is we don't have a baseline, right? Like we don't know if active duty families of color are saying, well, my children's education experience wasn't exactly amazing before the pandemic began, or their mental health, there were other things affecting their mental health before the pandemic began. As we've talked about, elsewhere within this report, there are other circumstances that can play a role there. So that is one piece of the data that I think there might be a little bit more to it there than we can kind of see at this point. Do you want to, Cindy, expand a little bit on some of the qualitative responses?
As far as qualitative goes, there wasn't a ton in the actual report about that, but we did in focus groups, some people were just expressing more of their weariness around what was going on. And this was 9 months ago that we did the focus group. So that was, I think we were all thinking we were about to turn, and that didn't happen. So, and I think back to looking at, well, what is happening in the civilian world, we know that, the Academy of Pediatrics declared an emergency of children's mental health due to the COVID-19 epidemic. So when we see that maybe and we're looking at this data, and so about military children's mental health, and we know that there were some huge disparities in COVID-19 related impacts to people of color. I think it's just something to pique our interest and do further research on into, is there maybe a protective factor here? We don't know the answer to that, but there's lots of data points that are saying that we should look at this further.
Well, ladies, thank you so much. And thank you to the rest of the fellows for great research that was done, important research. There's so much more that could be covered, but it's time to shift to the final panel, to my shipmate, Major General Juan Sonny Ayala in the great state of Texas in San Antonio. Sonny, over to you.
Hey, thank you. Thank you very much. Great panel, great questions, and Sync and Val, damn hard to follow all of you, so, and all the panelists. So again, Juan Ayala, 36-year Marine. I'm currently been for the last 6 years, the director of the Office of Military and Veteran Affairs for the city of San Antonio. Again, I want to thank all of you for joining the panel. This has been great listening. Yesterday was also, I got a chance, a lot of feedback, and I heard great things about it. Children, finances, and then we'll wrap up here at the end. And I think it's a great way to tie this this panel up. The researchers on this conversation who will entertain our questions are Ingrid Herrera-Yi, Senior Applied Research Analyst with the Blue Star Family. Welcome. Charo Bates, USAA Policy and Social Impact Deploy Fellow at Blue Star Families. Welcome, ladies, and from I don't know if you're still here, Charo, but it's awfully cold down here in San Antonio today, but welcome. What they're going to discuss today, and they've joined us to discuss healthcare, caregiving, and assessing resources. So let's get started here. And this is a statistic, and then we'll go to the first question will be for Ingrid. With few exceptions, at least 1 in 3 respondents from both active duty and veteran families report needing a non-medical resource or service, but not getting it. And a greater proportion of veteran family respondents report this to be the case. Ingrid, what are some of the top barriers, and I underline barriers, for both active duty and veteran family respondents?
Thank you so much. That is a great question. So many of us in attendance here, we have great programs. We come from nonprofits, from academia, all over, where we have all of these offerings, these resources to reach those who need them. And this study showed that they're reaching some, we're reaching some, but not all. And as Major General Aya stated, these challenges appear to be especially acute for veteran family respondents. They told us they required food, caregiving, housing, and other types of assistance since January 2020, so since around the beginning of the pandemic. And over half of these families reported not receiving support. Active duty families also reported this. So they had an unmet need, not accessing resources. There's a bit of good news in terms of mental health, which we'll talk about later. And that's that, a lot of our active duty and veteran families did access mental health care. And it's really an issue of, what are these top barriers for not accessing these resources? And what we found was that basically they had a few barriers that, came up top. And that's basically, I don't think I'm eligible. So they had questions about eligibility. I don't know how to access this resource, so they lacked the knowledge around how to access a service or a program, and stigma. And that is, they stated that they were worried about what others would think of them if they access this resource. For veteran family respondents, proximity was another top obstacle. So they didn't feel like the service or program was available close to where they lived. And these unmet needs really ranged from 1 in 3 to almost half of those who did not access needed resources. So they reported these barriers as the top ones. So when thinking about what could be at play, particularly for veteran families, they're not as connected as active duty military families to the resources, information that they need. Additionally, I really can't stress enough the importance of eligibility questions from them. These veteran families often face these barriers, wanting to know why, are they truly eligible? They do face, when they are researching, that they aren't eligible for many things. And so, although this is more anecdotal, that, they give up and don't ask. So this makes it clear that the need for outreach to our families of color, all families, but families of color, is that they're aware of how to access these services and about their eligibility.
Yeah, great answer. And I totally agree with you. I was the operations lead for the city of San Antonio's COVID-19 response team. And I want to add something else to that. There's language barriers that I think that we don't take into account. And the accessibility was very important. On the mental health piece, I saw a lot of folks, and this was mentioned before, that just did not want to admit, did not want to say that they had it. So great answer. I'm going to read another statistic, and I'm going to go to Charo for this one. About 4 in 10 active duty and veteran respondents report having difficulty finding culturally competent healthcare providers. Excuse me, Charo. Excuse me. What did respondents to your survey identify as key attributes when they're looking or seeking culturally competent care?
Thank you for the question, sir, by the way. Some of the attributes that they spoke of was finding a provider who understands what it means to be a person of color. And without having to come into your initial appointment and explain certain cultural barriers that you may have, some challenges, or even explain what it means to be who you are. The cultural competency component is so critical that it often prevents service members and their families and veterans from even engaging in treatment at all. 37%, as you mentioned before, required this and said that that was their hesitation behind actually seeking care. If you could imagine what most of us don't, or often a lot of people don't have to think about, is going to a doctor and worrying about any disparities that might come associated with your appointment. I just want to go and be seen and treated equally with a huge sense of understanding, and that's often not happening, unfortunately, with our families.
Yeah, that's very true. Where I sit, I see there's a lot of lack of care in the Rio Grande Valley here down in Texas. There's no VA there, and we have an immense number of veterans. And I think that's not only in the state of Texas, but in other states. Yes, I agree. Another statistic, and what I'm going to do is I'm going to start with Ingrid and then Charo, both of you. I'll think about this question. And I'll give you the statistic first. Not all veteran and active duty family respondents who require mental health care are assessing it. With many respondents reporting that stigma, active duty families 18%, veteran families 24%, that stigma was one of the primary reasons for not seeking mental health care. So question for both of you, and I'll start with Ingrid. Can you describe what reasons might exist for stigma to be a barrier for assessing mental health care amongst both active duty and veteran families in the survey? Please, Ingrid.
Sure, and I'll take a step back for a second. So about half of Black and Hispanic active duty and veteran families reported that they did seek mental health care, but that leaves about half that do not. And more strikingly, only about 26% of Asian active duty families sought care despite stating that they needed it. So these unmet needs, particularly in mental health. And a big part of that picture, as you mentioned, is stigma around mental health care utilization. In this survey, stigma was the top reason for not seeking mental health care. And it's an area that touches most military and veteran families, and even on the civilian side when it comes to mental health. But for active duty, the research suggests that there's still this fear of impact to the service member's career, including spouses reporting this as a barrier. And there's also self-stigma. So those fears that they'll be perceived as weak. And these beliefs often carry over when our active duty, reserve guard, our service members shift over to veteran status. So particularly for those who may have had some real experiences or consequences when they sought care and they were in service, it becomes a lot more salient for them. So when we think about mitigating this, some of what Charo was talking about, representation, culturally competent care, and continuing to normalize and model speaking out and seeking care, and making it clear that there won't be consequences to your service member's career, or if you are the service member, to your career, if you're seeking care. And continuing to give opportunities to these families and individuals to seek care in an anonymous or confidential setting, that is key, because of this, hearing over and over again that career impact is a real fear. And so, making sure that it's clear that seeking mental health care impacts the service member's careers is a non-starter, is important, and could increase help seeking.
Yeah, great points. Great points, Ingrid. Charo, your take on this?
Absolutely. The stigma piece is it's so critical, but I think we have to take a historical context moment within this. Recently, and when I say recently, it was last year, 2021, the American Psychological Association issued a public apology. Most of us on this call probably know about it, but they apologized for their contribution to systemic racism within the system and treating mental health care patients in general. And if you think about how long the APA has actually been around contextually, and the effects that that's had on people of color and perpetuating into that stigma. And so now you're talking about undoing years of historical influence on whether or not I can actually be seen when I go in to meet my mental health provider, or am I going to be tossed to the side or just put on a numerous amount of medications? This is still carrying on. We have a long walk ahead of us with reducing that stigma, but this is a huge layer into it. And also, as Ingrid mentioned, the career is challenging. I knew for years there was a back and forth where people thought, I'm going to lose my security clearance if I have a certain diagnosis attached to me. Some people still say that's not true, and others do say it's true. So when people don't really know which path to go or how to align themselves to be the best that they can be without denying their loyalty to their service, it's difficult. You just fall lower and lower and lower into figuring out how to be mentally stable and healthy. How are we reducing this? What is the role we're going to play next in this chapter? And how are we going to help our military family members and our veterans to reduce this layer of influence and stigma for years historically that has happened? So it's so difficult and so challenging, but this conversation is our start. This is
great, Charlie. Yeah, that absolutely. And this cuts across all our service members, all our veterans. The post-PTSD issues, the 22 veterans and active duty committing suicide every day. And I think there's something else to be said that both of you reminded me of, is that when we gain access or go to a mental health provider, 9 times out of 10 they don't look like us. Right. And so again, those are things that I think take time, but we need to look at. Hey, great, both of you, Ingrid and Charles, thank you very much. Those are great answers. We've got a lot of activity. I see the chat going wild down here. So Jenny, can you please take over here and go to the chat and get the first audience question?
Yes. Okay. So are there any specific racial or ethnic groups that you, Ingrid and Charles, would like to highlight that are experiencing greater disparities within our sample, specifically with regard to mental health and also caregiving?
Like I mentioned, our Asian active duty families, they went through over 4,000 hate incidents over the past year since that fielding. And they described this being an unmet need, mental health. So they need mental health care, but only 26% of them actually are seeking care. And so, that is very striking and something that, it would be great to, look further into. And, really it's consistent with a lot of the external research, but, focusing on our service members and families will add important new information to what's already out there in the civilian side.
Other questions, Jenny?
Nope, I think we're all right. Thank you very much, Juan. Okay,
Charo, Ingrid, thank you very much for walking us through the findings and all the underlying data that you really clarified for all of us on the mental health, on the caregiving and the health system. for everybody in the audience, I think we've got a lot of work to do, but we can certainly explore the findings of more of the recommendations when the report comes out, or it has come out, it's on the website. So great session. Thank you to everybody that's been participating. And at this time, I'd like to pass it to Blue Star Family CEO, Kathy Roth-Douquet, to close out the session.
Thank you so much, Juan. And thank you for all of the talented members of our Blue Star Families Applied Research Team, our partners at IVMF for the rich context they provided during this session. Thank you to our extraordinary members of our leadership committee, Valdice Nicholas, Admiral Sinclair Harris, Major General Juan Ayala, for moderating the session. You guys really were fantastic, and you actually raised the bar for all of us. I'm gonna try to live up to the model I saw here. Thank you to all of you who joined us today. We really appreciate you helping us to share this data and ask us more questions. These have been inspiring days, and they've happened in the backdrop of new deployments for the US military. And it just allows me to reflect that our nation really needs our military. Those of us who have served or continue to serve in it as a service member or as a family member, we know the pleasure and the privilege of that really important job we do. And those of us who love and serve this community know that we have to help each and every one of us be the healthiest and the best that we can be, thrive as individuals and as families so that we can do the job that we need to do for this country. Our survey showed a lot of strengths in the military and in the military families of color population. We also found a lot of areas where we need to do better, and we really can do better. So many of these problems we uncovered are solvable. Our next stage is to do more research and learn more, but it's also to start integrating these solutions and taking action. And we really look forward to having those of you who are on this call and beyond be our partners in creating that change so we can all be the best military families, the best military family support organizations, the best military and the best country we can be. So thank you for joining us. We hope to see you in future events, and we appreciate your partnership and support.